This recording is part 3 of 3 for chapter 5, the integumentary system. We've previously discussed mitosis and the fact that cells have to pass through restriction checkpoints in order to complete the process of mitosis, where we take one parent cell and form two identical daughter cells. One of those restriction checkpoints includes the fact that there has to be enough space for those two new cells to exist in order for them to grow and become specialized functional cells within that tissue. In cancerous tumors, what happens is those cells start growing and dividing, not regarding any kind of restriction checkpoint, and they literally grow on top of one another with no regard as to boundaries. Cells actually have boundaries, just like people do. If you're ever in a crowd of even your friends, you'll tend to maintain a certain boundary of space around yourself, and cells do the same thing within the human body. What happens with cancer cells is they just divide and divide and divide and grow and grow and grow with no regard whatsoever as to any boundaries that they would normally maintain under normal circumstances. They also divide so rapidly that these cells never grow into the specialized cells that they're supposed to be to perform the function for the tissue in which they are a part of. With skin, basal cell carcinoma is one of the most common types of skin cancers. Fortunately, it is one of the least malignant, malignant being a bad type of cancerous tumor, and it rarely metastasizes. The word metastasize means that it can spread from one tissue type to another tissue type, and metastasis is not a good thing. Basal cell carcinomas are frequently found on the head, on the neck, the arms, the back, where there is long-term exposure to the sun. And it's named basal cell carcinoma because it starts with cells in the stratum basal. It responds best when it is caught early, so it can be treated, and is often treated with either surgery, where they do what's called a 3 by 3 by 3 incision. They're cutting 3 times as wide, 3 times as long, and 3 times as deep to excise or cut out that tissue. Basal cell carcinoma can also be treated with cryotherapy, or freezing the tissue to kill it, or topical ointments that are acidic and will basically dissolve the cancerous cells. Squamous cell carcinoma is the second most common type of skin cancer. This is frequently found on the scalp, the ears, and the hands. It can appear on other places that are exposed to sunlight. Here we've got a really good example of some squamous cell carcinoma on the gentleman's nose in the picture on the top of this slide. Squamous cell carcinoma is going to affect the keratinocytes in the stratum spinosum. And again, about 20% of skin cancers are squamous cell carcinomas. This is a little bit more aggressive than basal cell carcinoma and can metastasize to other tissues if it's not removed or treated with surgery or radiation to stop the process of spread. The most deadly of all skin cancers, because it is highly metastatic, is malignant melanoma. Malignant melanoma is going to affect the melanocytes. A lot of information is in the name of the word. Melanoma, melanocytes. And this is where we have uncontrolled growth of melanocytes that metastasize and spread to other tissues very quickly, and is also very resistant to chemotherapy. Chemotherapy is using chemicals in the forms of drugs to stop the cells from dividing and spreading to other tissues. The malignant melanoma, a third of these types of cancer tumors develop from moles. And the key to prevent malignant melanoma from metastasizing and becoming a problem is early detection. It's best if lesions are found when they're less than 4 millimeters thick. And they'll also be treated with surgery, again, the 3x3x3 incision, and immunotherapy drugs are also often involved in stopping the spread of malignant melanoma. Malignant melanoma is distinguished by its appearance. There's an acronym known as the ABCD rule, where physicians will look for certain characteristics of a mole or a lesion on the skin. The A stands for asymmetry. One half of the mole or the skin lesion does not match the other half. B stands for border irregularity. So the borders may be ragged or blurred or just jagged in appearance. C stands for color. If the color differs throughout the mole or the skin lesion, that is a problem. Sometimes the colors can vary. You might see different shades of tan or black or brown, sometimes red, blue, or even white. Diameter is going to be a problem if the mole or skin lesion is larger than 6 millimeters, which is approximately about 1/4 of an inch in size, or maybe the size of a pencil eraser, or if there are changes in the size, if it's getting larger, that is indicative of a problem. Just as a quick rule of thumb, an M&M has the diameter of 1 centimeter, which is 10 millimeters. So if you cut an M&M in half, that would be 5 millimeters, just to give you an idea in comparison to what 6 millimeters would be. It'd just be a little bit more than a half an M&M. Skin disorders include things like eczema. Understand that eczema is a catch-all term for there's something wrong with the skin. Eczema includes allergic reactions. So if a dermatologist or general practitioner notices that a person is breaking out in hives, that is an allergic reaction. That reaction on the skin is often referred to as eczema. Or dry patches of skin or rashes. These things are all lumped under the generalized term of eczema. And depending on the cause, if allergies are the suspect cause, then the doctor may prescribe Benadryl. If it's something that's due to the follicles of the hair being inflamed, which is known as folliculitis, then the doctor might prescribe either a corticosteroid cream, or if it's systemic throughout the body, maybe a corticosteroid that's taken orally. Acne is a skin condition where the sebaceous glands get clogged up. Sometimes they get plugged up, or the follicle of the hair gets plugged up, so the sebum can't escape and go up the shaft of the hair that is exposed once it goes through the pore in the epidermis. With acne, when that follicle gets plugged up, the sebum and the cells of the epidermis that form the hair follicle start to accumulate, and if there's bacteria that are in that hair follicle, most bacteria will die when they're exposed to oxygen. There are some types of bacteria that thrive when they have no oxygen present because they are anaerobic, without oxygen, anaerobic microbes or bacteria. So Propionibacterium, staph, those are types of bacteria that prefer no oxygen. So if the hair follicle tends to get plugged up with keratin or sebum, then there's no oxygen. That allows for the bacteria to start growing, and we develop a little bit of inflammation with that hair follicle, and that's what causes acne. Acne is very common with the onset of puberty because the sebaceous glands do become a little bit more active during puberty. It's not just the apocrine glands, but the sebaceous glands are also going to become more active at that time. Vitiligo is a skin disorder where the melanocytes are either being destroyed or just not producing melanin, and they're not quite sure what causes vitiligo. There are different theories that it may be an autoimmune disease or that it is a genetic disorder. There are some researchers that believe there was an extreme case of sunburn that precipitated the process of the melanocytes destroying themselves. There are some researchers who believe severe emotional distress can cause vitiligo, but nothing has ever been proven to be the absolute cause of vitiligo. Vitiligo is more easy to notice in someone who has darker toned skin. It can occur in all skin tones. Burns on the skin can occur when the skin is exposed to either intense heat, ultraviolet radiation from the sun, electricity, or chemicals. The most immediate concern with a severe burn is that it can be life-threatening if it leads to massive fluid and electrolyte loss. That can cause what we refer to as hypovolemic shock. Remember, the words mean everything. Hypo means under or below, volemic referring to volume, so not enough volume of blood pressure can lead to shock. Our organs, in order to function correctly, that includes things like our heart, our kidneys, our liver, our digestive organs, all of our organs, our brain, they need to have blood pressure and enough volume in our blood vessels to carry oxygen and nutrients to the organs and carry away carbon dioxide and waste products. Most of our blood volume is fluid volume. So if a severe burn occurs, that causes dehydration where fluid loss occurs, and that means that the blood pressure in bodies drops. So hypovolemic shock occurs when the loss of fluids dips down dramatically. If there's 5 times less what should be there normally, then that is a huge problem for the survival of a human being. Burns can also cause problems with thermoregulation because remember, we use our skin to help maintain our body temperature. If skin is lost, that means heat is lost. And so that means that more energy has to be used to maintain normal body temperature. The obvious risk of damage to the skin is risk of infection, because once the skin is compromised, whether it's broken or burnt or dampened because it's been soaked for too long, that allows for bacteria to get in and become an opportunistic infection in the area where the skin is damaged. When severe burns occur on a person's body, the healthcare providers are going to use what is referred to as the rule of nines. The rule of nines is simply a way to estimate quickly the total body surface area affected in order to calculate how much IV fluid needs to be administered in order to prevent hypovolemic shock, so that the dehydration that has occurred due to the loss of skin can be countermeasured with intravenous fluids so that the body doesn't go into hypovolemic shock from dehydration. When we look at this picture, you'll notice that the rule of nines uses multiples or divisors of 9 to create a way to quickly estimate how much of the surface of the skin has been burnt. So the trunk on the anterior surface is worth 36%, as well as the posterior surface. The genitalia is worth 1%. The lower limbs, anteriorly and posteriorly, each limb is worth 18%. Each arm is worth 9%, and the head and neck, anteriorly, posteriorly, worth 9%. So that's a real quick way just to estimate by looking to determine how much IV fluid needs to go into that person to prevent hypovolemic shock. First-degree burns occur when the damage is limited to the epidermis. Now, that can lead to erythema, which is redness, edema, which is swelling and pain, and infection is limited with first-degree burns because the skin is still intact. Second-degree burns occur when there's damage to the epidermis and to the upper portion of the dermis. And because the damage is going into the upper portion of the dermis, we see the formation of fluid-filled blisters that are going to be very tender. And usually it takes about 2 to 3 weeks for second-degree burns to heal, and it can be very painful. Here you can see the fluid that's accumulating on this picture with the dermis being affected. So right in here. Third-degree burns include damage to the epidermis, the dermis, and the hypodermis, and are referred to as full-thickness burns. With third-degree burns, because all of the nerve endings have been burnt through from the epidermis and the dermis, there's usually no pain or edema. The skin will have a gray, white, reddish, or black appearance, and skin grafting is often required to help this type of full-thickness burn heal. Critical burns are going to be considered as such when second-degree burns occur over 25% of the body, or third-degree burns occur over 10% of the body. If third-degree burns occur on the face, the hands, the feet, those facial burns run the risk of the respiratory tract being burnt as well. So those are also considered as critical burns. The hands and feet run the risk of scar tissue forming, and because we use our hands and feet so much, that can limit the mobility when things heal. So that can be a potential problem with severe burns to the hands or feet. In treating burns, to prepare the tissue for receiving skin grafts, that process begins with debridement, which is removing the burned skin. From there, the area is flooded with antibiotics to prevent infection, and then the area will either be covered with a synthetic or living skin. Autografts, which are self-grafts, where a piece of skin is removed from somebody's body and then placed over that burned area, to help the area heal. Autografts are actually the best way to help skin heal in these third-degree burns where grafting is required. Third-degree burns often heal with extensive scarring and will often cause a limited mobility in joints or sometimes a loss in joints altogether. The pictures that you're seeing down below occur as the tissue heals. The fibrosis that we saw earlier will often cause contracture. The fibers literally pull things together so they can't move very well. Here we have such bad contracture in the toes that they're pulling them backwards. Here we have some skin that's been removed to be used as an autograft. You'll notice that it's been punctured to form a mesh. That actually helps the doctor to cover more area to allow for better healing. Sometimes before further grafting is done, they'll insert a balloon-like structure underneath the skin to help stretch it, because that pressure of stretching the skin will actually stimulate it to grow more, so they can grow more skin to remove it to use for grafting in other areas of the body. The younger a person is, the better the chance of healing, as you can see happen with this little girl. Skin grafting, really interesting process. Usually they split part of the skin graft off the lateral part or the posterior part of the thigh, and then they take that piece of skin and run it through a mesh machine, and that will help to increase the surface area twice as large as what they remove. And then they take that and place it over the area that needs to be covered, and they'll actually staple it on. So here we can see a larger picture of that skin being removed and run through that mesh machine to mesh the skin to allow for a larger area of skin to be covered. Usually it takes about 3 to 4 weeks for skin grafts to heal, and they always ask people to limit their movement so they're not tearing at this tissue as it's trying to heal. Obviously, after the skin graft is done, the area will be wrapped to keep it from becoming infected. So they'll cover it to keep it as sterile as possible. As people age, the rate of mitosis starts to slow down. Remember the telomeres, those little end caps on the ends of chromosomes? As those get shorter and shorter with each time the cell divides, they are less likely to divide as they lose the telomere that, again, shortens each time mitosis occurs. So we see that in aging skin, the rate of cell replacement has slowed down. The cells in the stratum basal, which normally undergo mitosis, are starting to do that less and less often, and that is also going to contribute to the fact that the skin is going to have a thinner appearance. The rate of collagen production is going to slow down, which leads to a greater appearance of wrinkles. The skin also has a drier appearance as the sebaceous glands don't produce sebum the way they used to. The skin is also more susceptible to bruising and injury because it is thinner, because the subcutaneous fat found in the hypodermis also starts to become thinner. That makes it much more difficult for people who are old to tolerate cold. So even though the slide says heat intolerance, when they don't have that insulation of a nice thick hypodermis throughout their body, it makes them more susceptible to cold around them, and they have a harder time staying warm. That's why older people like to move to warmer climates. The risk of skin cancer increases as people get older because their cells are more susceptible to ultraviolet radiation and the changes that can be caused by it. The hair starts to become thinner, it loses its shine and its luster. So it's important to get sun in moderation to convert vitamin D into its active form, but also to protect skin at the same time and not get too much sunlight. Or if someone's going to be out in the height of the sun exposure, to use sunscreen, get plenty of water, lots of good sleep to keep the skin healthy. And obviously you can see in the lower picture this person has just got a lot of sun exposure. Fibrosis is a condition of scar formation. Remember, when tissue heals, fibrotic protein fibers are going to knit things together. With fibrosis, we see fewer of the functioning parenchymal cells, which are the differentiated cells that are doing what the tissue is supposed to do. So we see fewer of those cells, and we have more of the collagen fibers that are left over from that scar formation. They're densely arranged, so there's not as much elasticity as there was in the original tissue, and there are fewer blood vessels. There are different types of scar formations. Sometimes a scar will form where it grows more than where the normal tissue was. That is referred to as a hypertrophic, hyper meaning too much or more or above. So a hypertrophic scar is the type of scar that will stay within the bounds of the original wound, but will grow above that. Keloid scars are scars that extend well beyond original boundaries. Hypertrophic scars, keloid scars, tend to occur in people who have darker skin tones. So we see examples of keloid scarring on the picture to the right, far right, as well as this picture down below. Those are examples of keloid scars, and it tends to be more of a genetic tendency for keloid scarring to occur, again, in people with darker skin tones. Stretch marks can be seen when people have either gained a lot of weight, or in the case of pregnancy, when the skin is stretched beyond the limits of its normal elasticity because of the rapid expansion and contraction from the sudden growth that can occur. And with stretch marks, they're usually linear streaks on the skin that will run perpendicular, and they're running perpendicular to the maximum lines of tension. And they begin as flat red lines. Over time, they're going to become slightly depressed white streaks. They tend to occur near armpits, on the thighs, the abdomen, the chest, the groin, depending on where the skin has been stretched. Now, depending on how much it's been stretched and for how long, sometimes people deal with a lot of weight for years, and that skin may be stretched out permanently. So if they lose a lot of weight, they may actually go in for cosmetic surgery to remove some of the excess skin that's been created, because as you've already seen, that skin can grow. Corns and calluses occur when the skin is constantly rubbed or has pressure or friction. Sometimes if there's a lot of friction or rubbing or pressure, that can damage the upper portion of the dermis, and as those cells are damaged, they'll release fluid, and that's what causes blisters. With constant rubbing and friction, that leads to calluses or corns, because that type of mechanical pressure will stimulate the cells in the stratum basal to undergo mitosis, and that produces more skin cells, and that's why that thickened area of skin occurs. for most people, simply eliminating the mechanical pressure or friction or rubbing will reduce the corns and calluses, and they'll eventually wear off or fall off. When people are dealing with diabetes, they are at risk for problems with their feet because people who have diabetes basically have too much sugar in their bloodstream. That makes the blood sticky, and it's harder for the blood to carry oxygen and nutrients. And imagine syrup going through blood vessels. It doesn't deliver oxygen and nutrients to the tissues the way it's supposed to. So that means it's harder for any kind of skin damage to heal. So if a person has diabetic neuropathy and can't feel his feet and has a cut on his foot, well, that cut's not going to heal as well as it would if the person didn't have diabetes. So he may not know he's injured, and then he's also set up for poorer healing simply because he's also dealing with diabetes. Diabetics can also experience ulcerations where the tissue underneath the skin and the skin starts to break down because, again, it's just not getting enough oxygen and nutrients from the blood that's supposed to flow to that area. Or they may get ulcers as a secondary side effect from bed sores. And if they're laying on a bony part of their body for too long and not being turned often enough, the skin can break down and ulcerate. Again, for people who are dealing with diabetes, they are not going to heal as easily. That is the end of this part for Chapter 5.